Single word to describe Eisner.
When I think of Eisner, some words come to mind.
I would say passionate.
Innovation.
Commitment.
Fortunate. And I say that because I'm very fortunate to work with a community that's in such need.
Love. For Eisner. Vision.
Happiness.
Support.
And compassionate as well.
My name is Felix Dominguez. I work in the pediatric department. I'm the team supervisor of care coordination. I've been working here at Eisner for 18 years now.
I'm Magdalena Estrada. I'm the director of perinatal education at Eisner Health. And I've been working at Eisner for 17 years.
My name is Pedro Gonzalez. I'm a physician associate here at Eisner Health, the adult department. I've been here for 17 years.
Hola, buenos días. Hi, how are you? My name is Elvia Rayo, and I am a health educator here at Eisner. Almost 15 years here at Eisner.
Hi, my name is Dana Ming, and I'm an executive coordinator at Eisner, and I've been here a total of 29 years.
I was born in Guatemala, so I'm an immigrant. I came to the United States because of a civil war in my country. I was an elementary school teacher, so my background is in education. When I was pregnant, I identified a big need for health education for mothers. And I couldn't find much available in Spanish. So that was really something that motivated me to change that. I was told as I got enrolled into a childbirth education program at that point, I was told, well, really Latinas do not want to go to classes. And so I couldn't accept that. I was like, no, that's not real. I'm a Latina, I'm an immigrant, and I know that there are many moms out there just like me.
I grew up poor. I grew up not having everything that maybe other people have today. And I feel very fortunate to be able to get educated and graduate. I'm the first in the family to graduate from college. And at that, it's my obligation to give back to the community.
I originally heard about Eisner over 17 years ago when I was looking to work at federally funded qualified health centers. And there were not that many around. So I did some research, and I liked the diversity that here in downtown Los Angeles and that Eisner served. I grew up about 3 miles away, and I decided to apply to Eisner.
My favorite part of the job here is showing up every day and working with the children. I always tell people, they keep you young, they make it fun for you.
Coming into work every day and helping people with what we have here, connecting with the patient, and knowing that once you take care of that patient, they're going to go back home and feel happier, and therefore they make the lives around them happier as well.
My favorite part here at Eisner is teaching, education. Yeah, this is my favorite.
I love the people that I work with. They're all different in many different ways, and but they're special, and they care about Eisner, and they care about what they do, and they're passionate about what they do.
People says that I help them, but no, they help me.
What I believe makes Eisner unique is our level of compassion and focusing on the patient's outcome.
The patient population. There are many people here that have suffered through the community here. They have no other place to go. The support and the services that we provide to them may not be fulfilled if they were to go somewhere else.
We can even see it in the mission statement, right? Health as a human right. And that's a big motivation for me.
I love our mission. I think we've stayed really true to it, of helping our patients in the community regardless of payment.
We have everything. We have everything, and we can give all of this to our patient.
The different types of services that we offer to the community, we have dental services here, we have mental health services, we have pediatric services, the Women's Health Center, we have the mobile unit, we have the high school-based program. So I think we touch on areas of need that this community actually needs. So I think that's what makes Eisner very unique.
The services that we offer the community, and I think of how important they are, especially what we do at the high schools. I think for a young girl as myself growing up in this community and not having the resources, being a daughter of a teenage mom. She had to work to get, be able to pay for things. And so often we didn't get medical care. Unfortunately, my sister was also a teenage statistic of pregnancy. And I think, wow, if we had Susan Manabo or Pedro Gonzalez in one of those clinics at that time, what her path might have been a lot different. A lot of the children in these schools in our community come from parents who were not born here, who don't speak the language, who are teenage parents as well, and don't have the resources to get their children the care that they need. So I think what we do in the schools is important so that the kids can advocate for themselves.
I'm really driven and passionate, I would say, about maternity health and paternity. Implementing all the services possible for the community that we work with to improve birth outcomes.
Many of the barriers that I encounter when working with the patient's parents is fear. They're afraid to take the services, and reason being they feel because of their citizenship status. That's one. The second one would be compliance, because there's a lot of stereotypes, a lot of myths about medication use, or a particular service like mental health would be a big issue. It's almost like a taboo for them, and for them to be able to accept the services, it can be a little difficult sometimes.
We work with the low-income community and new immigrant community, non-English speaking clients as well. And we're able to integrate the services, expand the support, the access.
It's comprehensive. They can come in here and get care in the language that they speak, whether it's Spanish, Chinese, Korean, Russian, or even sign language.
One of the great things here about Eisner is our enhancement of senior care with adult wellness exams that they give them a full hour or even more and discuss their transportation issues, their food issues, and what have you. We also have a great team, a case management team, which they help them find other resources, whether psychiatry resources, rent resources, water or food resources. So although I'm not involved at every level, I know that the patients are being taken care of. It makes me feel very proud that we can offer all those resources.
Our people here at Eisner, they need many, many things. And Eisner is very good, and we provide those needs to them.
Here at Eisner, I've had some full circle moments of seeing the patients when they were in their teens and now they're parents, and now I'm seeing their kids as teens.
So I actually was a patient of Eisner. I got my braces here, and from there I started referring my family here for dental care. So my kids came here, my husband came here. When I did my health screening here at Eisner, my new hire screening, the doctor asked me, "How long have you had asthma?" And I was like, "I'm sorry, what?" And he's like, "Oh, you're asthmatic." And I thought about it, and I thought, wow, I've always been sick my whole life. So I've seen firsthand how people benefit from the services that we offer here.
¿Por qué estoy aquí? ¿Por qué estoy aquí? Porque amo a Eisner. No tengo límites en Eisner.